We're not focusing on just an individual, we're looking at the whole system, which is why it's called systemic. So when parents come, for example, with a concern for one of their children, we tend to widen the lens and look at what's happening within the whole family. We look at relationships, we look at patterns, we look at interactions, and we tend to focus more on the present interactions. We might think about the past, but that's about how it affects the present. So we are concerned about relationships rather than focusing only on one individual. We work with all kinds of problems, and we work not just with families, but we also work a lot with couples and with individuals as well, and with organizations and wider professional networks. So although we're called family therapists, we really work with a lot of different configurations and with a wide range of presenting problems. For example, sleep difficulties, eating difficulties in very young children, separation anxiety, especially at a sort of school going age. We deal with illness and bereavement, the effect of chronic illness on different members of the family, and the effect of bereavement on the children and other members of the family. So really a wide range of presenting problems across the whole lifespan. So we're looking at about 8 to 10 sessions usually, although of course it depends on the needs of the individual couple or family. With some couples and families, treatment is much faster, and we're looking for sort of up to 6 sessions. For some it might last longer, but 6 months I would say is approximately the time frame. Sometimes families and couples will have a series of sessions and then come back later on for more sessions. For example, recently I had a couple who did some work for about 4 sessions, came back again for another 4 sessions when things got tricky and difficult again. And we do try and keep a very good relationship and connection going with our clients. As a South Asian woman myself, and as a migrant to this country, I do get lots of referrals, and I'm drawn to working with families and couples from different backgrounds. And as this is such a multicultural society, I think this is a growing area of work, and something that's really important for a family therapist to try and understand how culture impacts on family relationships. Sometimes for young people going to school, they might feel very different from their peers. I also work a lot with intercultural couples, and this is a growing area of research and practice, where the 2 partners might come from very, very different backgrounds, religious backgrounds, ethnic, cultural backgrounds, and how do we negotiate the differences between them, and how does this also impact on their parenting. And here again, I try and help couples and families to appreciate these differences, to talk about them, and to try and find a way of resolving them. We're really very lucky here because it's a very unusual and exciting place to work, and it really is the professionals who work here who make the place. And we're lucky to have a range of professionals who come from so many different backgrounds, but they're all very senior, very experienced, very well known in their fields, very established. We also have a consultant pediatrician here, which is quite unusual. And that means if we're ever stuck with a case, we can get a different opinion, a medical opinion. And we're also very lucky because we have a continuing professional development academic program that any of us, all of us, can partake in. And we take it in turns to present our own practice and our own research interests.